this afternoon, so you're all very welcome. Please put questions on the WebEx chat function. Find it there. A bit of background noise there for the moment, but put your question on the WebEx chat function. In a minute, I'm going to ask Breda and Tony to give us kind of an account of what the last 3 months, this extraordinary quarter has looked like. Paul described it as 3 months that we don't like to forget, but probably never will. But first, maybe I'd ask Paul Reid. I know Paul and involved in discussions with them in advance of the decisions this week. There are important decisions on restrictions into the future. I know we're at a time when the vaccination program is going to accelerate, but maybe Paul, you give us a sense of where you think we are now. And if there are people on the call who aren't on mute, could they go on mute? There's a fair bit of background noise. Very much.
Yeah, thank you, Mark, and good afternoon, everybody. I can't see you all, but I know you're all looking great. And we won't go around and ask everybody to introduce themselves, but I do believe there's some great numbers registered, and thanks to everybody for that. Look, as Mark said, firstly, thanks for the opportunity to talk with you all. And it's one of the first regional webinars that we're engaged in. You are aware every quarter we do one nationally, but I think this gives me a better opportunity to connect with you in your own communities, in your own teams, and with your own management. So it's great to be able to do that. I just want to respond very briefly to Mark's opening comments. And I did, as Mark has said, Mark, you might want to go on mute as well for a minute. It's a bit of a noise as well. I did, as Mark had said in the open comments at our press conference last week, but equally important at the Government Cabinet Committee on Monday night. I made a statement that the last quarter is probably one that we'll all remember, most certainly, but one that we probably all want to forget as well for many reasons. And I do want to acknowledge it's not just about the last quarter, it's particularly about the last year and what everybody has been experiencing, what everybody has been leading, and what everybody has been sacrificing all across the health service, and all of yourselves and all of the teams and the acute community, and indeed in our disability and mental health services. But I just want to give you a very quick reflection of what I did say to the Cabinet Committee meeting the other night, without breaking confidentiality, but it's what I've been saying publicly. And first of all, what I did say was, over the last quarter, and just let's try keep it to that, but it's reflective of the last year. The health service came under the most significant pressure it's probably ever come under in the history of the HSE. I know winter plans, I know winter is tremendously difficult, but I think what we've had to face this quarter needs to be recognised as that. Second thing I did say, in doing that, the response of the health service and the response indeed from the Saolta and the community organisation in the West has been nothing but phenomenal. Because very briefly, just try to summarise a few things that I did mention. First of all, how we invested significantly in our community services to relieve and support the pressure on our acute services. And that goes from everything for our multidisciplinary teams who supported people being treated at home, the supports we put around nursing homes, a new role for our National Ambulance Services and how they worked with communities like they've never worked before in a whole range of activities. How we worked with GPs and the supports you put in around GPs and access to diagnostics. How you managed to, particularly in the West, put a high significant focus on digital and telehealth, particularly around our mental health services, was quite incredible. And I did visit in Roscommon, the mental hub, early throughout COVID. So all of that activity, and along with that, to look at the pressure that was on our hospital system all across the group, whether it was in Letterkenny, particularly in Galway and Mayo, with Sligo as well, and Roscommon indeed for various other services. I think it's been phenomenal what has been achieved, the lives that have been saved, how our clinical teams, critical care teams, scaled up to the level and extent that was needed has never been done before. We have early last year about 225 critical care beds. We quickly moved it up to 255, then moved it up to 285. But through your teams on critical care, that was accelerated up to 340 beds throughout this last quarter alone. So I know I'm not reflecting all of what has been going on, but that's certainly what I reflected at the Cabinet Committee. And the reason I did all of that was, very briefly, to look forward into next quarter. My strong recommendation was we have to protect the health services and never let it get hit to the extent that we have experienced, particularly over the last quarter, but ultimately over last year. And final message to myself is, and hopefully we get a chance later to talk about it. I know I'm looking backwards the last quarter, but I do think for everything that all of you have been through as healthcare professionals and workers, we can give you great hope. We can give you great inspiration as we look forward to the next quarter, because we certainly are starting off in a much better place than we did start off in January. And that's largely driven by the vaccination programme, largely driven by the extent of which you scaled up to deliver the vaccination programme, and largely and specifically driven by the successes that we're seeing from the administration of the vaccination programme, whether that is in significantly reduced mortality, high levels of reduced sickness now in nursing homes at a level that is at the best level throughout the year, radically reducing the numbers of healthcare associated infections in our services, and a dramatic improvement in the percentage of the total cases on any daily basis or weekly basis that are coming from healthcare workers. So we know the vaccination programme is working, and that gives us all great hope for a better quarter ahead. But I think we might get some time. But I'll pass back to Mark now over to the team locally.
Okay, thanks very much. And let me formally introduce Breda Roach, who's the Chief Officer of Community Healthcare West, Tony Canavan, Chief Executive Officer of Saolta Hospital Group. I'm Mark Brennock, I'm the National Director of Communications here at the HSE. I see questions coming in on the chat function. Keep them coming in on the bottom right of your screen. Before I take some questions, maybe I'd ask Breda first, if you could give us a sense of what the first quarter has been like for you, what the first quarter has been like in Community Healthcare West.
Thanks, Mark, and good afternoon, everybody. It has been a tough quarter, and I suppose it started just after Christmas. When staff came back off their Christmas holidays very, very willingly to support the different services. We had significant outbreaks in our older person services in particular, and it was really, really difficult. We worked very closely with our colleagues in Saolta. Geriatricians went in and visited nursing homes, helped and assessed. We had staff across Saolta, our own staff. People came back off their holidays, as I said. Weekends were given up in the last quarter, and it has really, really been tough. But having said that, we have achieved wonderful services as well. It brought the best out of people, to be honest. And when I look over this quarter, we have we've been involved in serial testing, we've been involved in the nursing homes, meat processing, and obviously we have also been involved in the drive-throughs. So if you look at the last year, we have carried out over 266 tests in the community. And we're now going to set up a walk-in in Banslow tomorrow over the Christmas over the Easter holidays. So people have been magnificent. Our staff have been fantastic, and we've worked very closely with the local authorities and public health also, and our colleagues, of course, in the National Ambulance Service. Thankfully, with the vaccination programme, and that gave great hope. And I witnessed it myself when I visited. I'm located in Merlin Park. When I visited Unit 5 and 6, the first day of the vaccinations, and the sense of joy, the sense of relief, the sense of celebration was just palpable. So this vaccine programme, and we have carried out almost 19,000 vaccines in long-stay community services, and including older persons and in disabilities and mental health. And that has given great hope to people. We have, we have rolled out digital health, Attend Anywhere, the whole infection prevention and control, the investments have really, really assisted us in delivering services. So while it was tough, we also achieved many, many things. Thank you.
Okay, thank you very much, Breda. And totally in one way, I suppose we don't necessarily need to ask you what things have been like in the first quarter. We can imagine what's been like in the group. Maybe give us a sense of that, and also what you would say to staff about the period.
Breda might need to go on mute. Breda, I think you might need to be mute.
Do you mind, Mark, if I ask you to repeat the question, because I actually missed it there? Thank you.
Yeah, what I was saying is obviously we could ask you to give a sense of what the last 3 months have been like. I think we all know the answer. We all imagine what it's been like in the acute hospitals in the west of Ireland as elsewhere. But maybe give us some sense of that. And in light of that, what would you say to staff about the coming months, about where do you think things might be going to go?
Yeah, I think people have a sense over the last 12 months of what hospital life has been like throughout COVID, and there's no need maybe for me to go back over those steps, except to say that wave 3 of COVID was exceptional in every sense, not just the scale of it, the numbers of patients that we had to deal with, but also the pace at which it progressed into the hospitals and then through the hospitals. So I think those really put all of our systems, and more importantly, all of our staff and all of our people under serious pressure. One of the striking things that came out of it, I suppose, was the way in which people were prepared to support each other in providing support to patients. And people cross boundaries in all sorts of ways and in all sorts of imaginative ways in order to be able to make that happen. So we had, for example, over the first 3 months, we had significant numbers of transfers of patients from ICUs in various hospitals, from Mayo down to Galway, from Mayo down to Portiuncula, from Letterkenny down to Galway, and so on. We had support reaching out from the hospital out to long-term care to try and make sure that residents there stayed living well in those settings without having to be admitted to hospital. With staff from the hospital training up and being ready if they were needed to work in the ICU. And so there was a huge, I suppose, coming together of people to support each other in order to be able to provide care for patients. I think what we're looking at now over the coming 3 months is to some extent, cautious optimism. So we see our numbers in hospitals today. They're still there. We still have patients that are COVID-19 positive, and they're staying at a kind of a stubborn level. So they haven't reached they haven't gone out as low as we would have wanted them to, under level 5. And so we're looking at that very cautiously and always a bit wary that the potential and the possibility for further expansion of COVID-19 in the community will lead to further hospitalizations again. But we're also looking at it with optimism, and that's the point that Breda was making as well. And the optimism really stems from, I suppose, first of all, the way in which we have managed to respond, the way staff have managed to respond to the needs of the communities in which we live. But more importantly, I think also to the promise that comes with the vaccination program. And again, this is something that staff working within the health services across every single division are coming together in the West to try and support. And so I think that the vaccination program is a real source of hope for staff in terms of what they want to do in delivering services and in providing care to people living in their community.
Okay, thanks very much. I have a specific and practical question here from Siobhan, which is, what can we do to address significant IT issues raised following the first wave? We're talking about access to online meetings, platforms, technologies, devices, and so on. Has that changed over the past year, and how can we support staff who can work from home so effectively?
Do you want me to take that, Mark? Okay, I take it very briefly, and again, Breda and Tony might want a brief comment, but we'll try to be sharp on our answers, give people a chance. But very simply, from my perspective, look, first, I know many of you have worked in the health system much longer than me, and there is a lot of legacy systems and history of not having the capacity or systems that interface with each other in particular. I think one of the strong things I will say has come through in the last year is that, firstly, and our IT teams, I want to give them great credit locally and nationally, but the solutions they put in were really quite good. So we never had a testing and tracing system, for example, but very quickly, and this was done locally as well, putting in place links between a GP system, HealthLink, and our own systems to automate the appointments process and for people to go forward for testing was very significant process to be scaled up straight away. There's also another number of solutions that we've put in place now in terms of the vaccination program, but also a range of telehealth and e-health solutions. Specifically around, I think where the core of the question was around, around bandwidth and local infrastructure. I know we're behind. And I've been in many of the healthcare settings across the West, both on the acute side and the community. And I know some of the really challenging issues that are there in terms of bandwidth, accessibility, fibre links. And that is something that we have to keep as a priority, because I think we've all realised the gains to be made this year by moving to greater levels of technology, and our services held across technology. And finally, the one thing I will say is, and again, this goes to community and acute services, the manner in which a lot of our teams manage consultations online, I think has been quite transformational. So to keep a lot of our mental health services going, as I mentioned earlier on, and other physiotherapy services or therapeutic services going online, really, I think, gave greater confidence to people who are trying to serve and support.
Okay, thanks very much. I think just we don't need to ask everyone to answer every question, or we won't get through too many, but Breda or Tony, feel free. Have you anything you'd like to say in relation to that issue of working from home and IT?
Okay, can I say that we've made great inroads? When we started off, in the first wave, we deployed 400 laptops so that people could work from home, be safe, and continue their work. We have Attend Anywhere. We have really rolled the whole thing out. I think we have done in a few months what would take years to do. And, we were allowed to do that and enabled to do that, which is fantastic. And, I had one person working in IT, Val, who was just magnificent and has worked with everybody, has supported everybody. And, we are looking now, there will be investment in relation to digital health and posts. So that's fantastic. And, when we started, we were using Skype. We now have Teams. We now have WebEx. We have a weekly Teams meeting with the local health authorities, with the Gardaí, myself and Tony in Saolta, emergency management, public health. These are all new platforms. These are all new things. And I think that it really has brought us light years ahead. And it's something that we're looking at now in relation to remote working and how we do that to best serve our service users and citizens of Galway, Mayo and Roscommon.
Okay, thanks very much. Tony, have you anything to add to that, or?
Not really, except I suppose the one thing that COVID has emphasised for me is the importance of us having, information systems, and particularly, I would say, the one real key enabler for the country, which is an individual health identifier. In order for us to roll out national vaccination programs, and to be able to, I suppose, to provide national health programs, having that fundamental building block is really important, and COVID has just re-emphasised that to us.
Okay, thanks very much. There's something Breda said there, which I've heard echoed by an awful lot of people, which is we've done in a few months what would otherwise have taken us a very long time. And I think that applies in lots of different areas around the health service over the last period. And I have a question here about, say, that the last year shone a light on a lot of good things in the health service and a lot of not so good things. And I suppose maybe to ask about the West in particular, are there some really good things that you've seen teams and services do in the past year? If you were to pick things, you said, right, in the Western region, we're very proud of that. What would they be?
I'm going to jump in there first. I think what we've seen in the last year is that the hospital perspective has started to change, and I don't. It's not all down to COVID. I mean, I think that in many respects hospitals were outward looking, but of necessity because of COVID, we had to look outward and to see what was happening in the community and understand that, and in practical ways then respond to that. Reid referred earlier on to the fact that at the very early stages we had involvement from consultant geriatricians, palliative care consultants, consultant respiratory physicians from our hospitals in Mayo, in Galway, in Roscommon, reaching out to private nursing homes and to facilities where people were living in long-term care in the community, to try to make sure that when those services and those institutions were coming under pressure, that there was a strong clinical response and good source of advice, so that patients, so that residents in those facilities could continue to live out their lives there. And similarly, that our nursing staff, support staff as well, when it was possible, they responded and reached out from the hospital to work in facilities to try and make sure that they stayed open, so that residents could continue to live in their homes rather than be transferred in emergency circumstances into the hospital. I think both of those for me were really strong examples, first of all, of good clinical care and a great clinical response, which we do see all the time in the West as well, but also I think a great indicator of people's perspective changing quite significantly, I think, over the last while.
Okay, thanks. And Breda, on the community healthcare side?
Again, people working together. We've had in this quarter, we've had numerous outbreaks in nursing homes. We worked across the private nursing homes. We normally didn't have any role there. And our staff went out, and as Tony said, staff from Saolta, my own staff, they went out and they worked in 66 private nursing homes. We educated people in relation to PPE. So everybody was working as part of a team. And it really was, I think also in the last number of months, I think the public have recognised that we play a very, very good role in society. And I think the value of health services has increased. I know that's obviously very transient, but certainly I think that, and I think that there's more transparency and more accountability in our systems for sure. Staff were fantastic. They just, my staff had to go out into meat processing plants and do testing. They had to set up static test centres. As I said earlier, we carried out 266,000 tests. So that all takes great teamwork, and people just, did whatever was needed, and we're glad to do that. And we learnt as we went, because when we started off a year ago, we didn't know much about COVID. And we've learned an awful lot, and the investment of PPE and all of that has greatly assisted. And I think it has raised the standard for sure of our services. So magnificent work, tremendous teamwork, and we work very closely with the local authorities and Gardaí and emergency management and public health. So it was real teamwork. And I think that will stand us into the future.
Very much. Paul, have you anything you want to add there?
Yeah, just a couple of quick things to reinforce. One, I think the region has stood out for me in terms of integration, and I think both Tony and Breda have covered it well, so I won't. But it has stood out. It was notable. The integration processes that were there, they're working. The multidisciplinary teams, both Tony and Breda have referenced them, and in a time of urgent need and care, people mobilised very quickly. So I just want to single that one out in particular, and then to emphasise the point, how much that means, both for patients and people who are using the services, but also just to say to you how much that means nationally to help me make the case to government for more funding, which I know we'll get a chance to talk to before the end. So these things matter really well to people's lives, but they matter really well to ensure that we can demonstrate what we've done, and for help me make a case for further funds from government, which we've been very successful in getting. And in case I forget to say it again, the one other point I would strongly emphasise, and I do read a lot of the regional and local papers. I do live on the border in Leitrim, but I do know the communications equally from the group and indeed from the community organisations being really strong. And that gives people what Breda spoke about there. That gives people confidence, and that gives people valuing us as a trusted source to go to for information. And Breda's right, it's always fragile, but it's at a really much stronger base than we have been for a long time. So I think those things matter, just to say that to you.
Okay, thank you. And you mentioned the services operating in a very integrated way. There is a question on that from Aoife, who says, is there a latest update on the Sláintecare proposal to integrate the hospital groups and CHOs over time?
Yeah, I can give a quick piece on that as well, and Tony and Breda, feel free to come in. So everybody knows that Sláintecare is government policy. Very positively, it's cross-government support for it. I like to use these briefings to be open and frank with people, because I don't know any other way. And I'll just share with you what I have been saying to the Minister, to government, just around priorities. What I've been saying is, look, first of all, what we demonstrated over the past year, demonstrate capacity of our system to work together in an integrated way and to mobilise services. I think it was Breda or Tony referenced a while ago there. We've done more in the past year than I believe we would have done in the next 5 years under the, and that's not about Sláintecare, just it's around mobilising and funding to support it. So we have accelerated Sláintecare really well. So first of all of the stuff that you did putting in place, whether it's enhanced community services, whether it's multidisciplinary teams, whether it's integration, whether it's scaling up critical care beds, whether it's putting in extra capacity in our beds, whether it's working with the private health system to get extra support, whether it's working with GPs for access to diagnostics, that is Sláintecare. So this sense, and I've said this to government quite strongly, the sense that we're waiting on a big moment for Sláintecare, it's happened. And we're probably well ahead than we could have ever expected to be ahead of it. And the second part I will say, which I know is the core of the question, what I have said to Minister, Government, and what I passionately believe in and said to our board is, our priority for the next period, whether that's the next year or 2 years, and it's reflected in our corporate plan, has to be strengthening the services and continuing to strengthen the services. We should not get lost in second guessing regions and organisation and structures around regions. We should keep our focus on services. And I'm being an open, as honest as it can be on that. It's still government policy, regions, regional health areas. But I'm saying very strongly, I want our priority to be for the next year, 2 years, on focus on services and not organisation. And that's what the public would expect, I believe. So I think there's been some learnings from two learnings from what we've seen so far. One, we know what we can do about Sláintecare, and we've done it really well. It's happened. And number two, there's learnings about what the priority should be going forward. So I believe regions are still government policy. I have to always say that, and it is. But I certainly want our focus to continue to be on services.
Okay, Breda or Tony. Breda, I saw you'd been nodding your head during some of that.
Yeah, I mean, look at, the service plan, there's huge investment, in Community Healthcare West. Full year costs will be in the region of 33.8 million, and we'll be rolling out community networks. We'll be rolling out integrated care programs for older persons, chronic disease management, diagnostics. There's even eating disorders in mental health. So there's a huge investment, and it really is Sláintecare in action. And the whole premise is that services will be available to people as to enable older people, and indeed people to access services in their community, and to enable the older people to live the way they want to continue living at home as long as they can with the supports that they need. And there's a number of consultant posts that we will be working very closely with Tony and the sales group in relation to geriatricians and many posts. So this is all huge investment, and it's a fantastic achievement. And to think that there's so much investment, really, it's to acknowledge the work of Paul Reid and the board and the various national managers, because it is significant and unprecedented. So the future looks really, really good. And it's all about interdisciplinary, it's working together, and it's about delivering the services that people require within their communities.
Okay, thank you. And Tony, if you have something to add, actually, we have plenty of questions coming in. Feel free, please, to add anything on the integration issue.
Sure, yeah. I mean, just a bit like Paul again, I also have to be really honest and say I'm a really strong proponent. I'm really strongly in favour of Sláintecare, and I believe really strongly in the idea of local decision making and local empowerment. So that's my starting point. But if you were to ask me today, what's more important, is it developing patient services and making sure that every opportunity that Breda and I have to integrate care in a way that makes sense for patients? Well, then that's an easy question for me to answer as well. We continue to put our effort into making sure that we develop the services, implement the service plan, make the service better for patients, and whenever the regional health areas are ready to be rolled out, we'll be ready for them.
Okay, thank you very much. We talked earlier about the good things, the best things we've seen in the last year in the health service. We have a question in from Siobhan. One of the more sad and upsetting things that happened over the past year was in relation to residential care, and they're asking, have we lessons to learn about governance in the area of residential care in the light of the past year?
I'll answer that one, Mark. And it's a question that we've been asking ourselves. And we had a look back meeting yesterday in relation to what have we learned from COVID? What would we do differently? And we've learned an awful lot. And clearly, the Nightingale wards, all of that has to change into the future. We are looking at, if we're building a service right now, what would it look like? What would it need to have? You know, again, we had one of our district hospitals, which would be it actually has single rooms, and yet the infection rate was high. And when we looked at why was that, it was because, again, of touch, you know, frequently touched surfaces. It was about nurses' stations. So we've learnt all that, and we now are putting that learning into action. And, you know, again, it's about ensuring that we provide the services that are required and of a very high standard. And, you know, we are regulated by HICWA in older persons and disabilities, and indeed the Mental Health Commission and mental health services. So, you know, there's lots of work going on, and certainly the intention is to provide services and to have good governance, both clinical and executive governance. That's vital.
Okay, thank you very much. Either Tony or Paul, anything to add in relation to governance in residential care?
I just would, yeah, please, Mark. A lot of what Breda said, just add a couple of points extra. First of all, again, I've been on the record on this one. If we don't stand back and try learn some really strong learnings about what happened in nursing homes, you know, we failed, and I'm glad the way Breda summarised it there. I guess on a national perspective, I have a couple. First of all, I think from a policy perspective, we really need to stand back and consider policy for older care for the future. Congregated settings are not conducive to managing in pandemics. That's a simple fact. And it really needs to be thought about from a policy perspective for the future. I think the expert panel that was commissioned by the previous minister kind of set out some of that as well, and set out some of the learnings. So I do think that's a factor. I think if you look back, I think there's also an issue around who was really responsible. And Breda touched on earlier on, like, we don't traditionally have responsibility. We don't legally have responsibility for private nursing homes. But we did have to intervene, and we did, we quite rightly. But that is an issue that can't be left kind of just done because we think it's the right thing to do. We either need to have the rights and legislations and the power and legislation, and there are a number of other regulatory authorities like HICWA, as Breda said. So there needs to be some learnings from that perspective as well. And then finally, I would just say the learning on the virus, I think, was very strong for all of us, just about how it got in a very asymptomatic manner, how it took hold so quickly. And I met GPs actually in Roscommon, in Castlereagh, who were in one of the COVID hubs, and they told me how they had been in, you know, a short while previously. This is back in the first phase, visiting some of their patients, and they were fine. They were in great form, and 2 days later, they were in really in a bad way, and sadly passed after about 2 or 3 days. Passed away. So there's learnings about the virus, there's learnings about strategy, learning about policy, learning about roles and responsibilities. I think we have to be honest.
Okay, thank you. We have 2 questions on mental health services, Angela and Liz. One saying, we already had a pre-existing mental health crisis in Ireland before COVID. What are the plans for the future of mental health services to ensure we have the staff that we need, that we're well below recommended staffing levels? And Liz is asking particularly, saying, we mentioned eating disorders in mental health services. Does this mean we'll be getting additional staff and resources for community mental health teams? My own team doesn't have psychology or an addiction counsellor. We have many people on our caseloads with addiction problems and eating disorders. I think that there are issues we hear about in various different places. But on the issue broadly of resources for mental health.
There has been investment this year, and I work very closely with my head of mental health services, and that's Charlie Meehan, and the 2 executive clinical directors, Dr. Mandy Burke and Dr. Anne Cullen. And there is investment. There are additional posts coming in, and there is a consultant for eating disorders. So we're looking at that, and now that's in relation to CAMS. So we're looking at those services, and they are being developed currently. Yes, there is catch up, and also there's learning from COVID. So that's ongoing as we speak.
Mark, if I could just add a quick comment, if you don't mind, just to add to Breda. Just first of all, mental health is one of the top 6 priorities identified by our board for the corporate plan for next year. In our national service plan for this year, to make a commitment to that, there's an extra, I think it's 83 million. I don't have the figure just in front of me here, but in terms of mental health, yeah, it's 83 million, which is an extra 8% investment, incremental on mental health for next year. So it is one being identified by the board. It is a priority. And in terms of resourcing, we might touch on this later on, but we have never had a budget to the extent what we have for this year coming ahead to invest in the right resourcing of over 16,000 staff nationally. And Breda and Tony know the detail that locally, but yeah, has to be a priority.
Okay, thank you. And a question here from Adrienne. Do you think COVID-19 and the pandemic has strengthened and highlighted the prevention agenda, the need for health promotion to be more included in service planning for the future?
I can take that one. Absolutely. And we have investment. We have over 8 new posts this year. So they will be rolled out in relation to the community health networks and the enhanced community care teams. So it's very important. And again, it's about that people will live well as they can, and also own their health, that they have responsibilities in relation to that. And we have lots of investment in relation to Healthy Ireland and lots of projects rolling out. So it's a very important area, and there is investment. So and the operational plan includes all those developments.
And just to add to that, Mark, as well, one of the things that I often think about, we talk about integrated care and the role of patients and so on, and particularly on the hospital side, we have a kind of at times we can have a view of patients that they're almost, that they're passive recipients of the care that we provide to them, But I think one of the lessons from COVID, if you look at the first wave and you look again more recently, and how that wave was flattened, it wasn't flattened by me or the decisions that I made. It was flattened by every individual in the community and the decisions that he or she made about how they were going to restrict their movements or restrict their contacts and so on. So I think COVID handed back to the population because we had to control over part of that outcome, and they took it, and people in the community really, I suppose, demonstrated, that the influence they can have on their own health. So I think there's a lesson for us in that. I'm not entirely sure yet how we continue to kind of capture that on an ongoing basis in relation to other issues like chronic illness management or chronic disease management and so on. But there's certainly a lesson for us as healthcare providers from that.
What I might add to that, if I may, Mark, please. We have the making every contact count, smoking cessation, developing physical activity pathways, social prescribing, and they're all ongoing in relation to health and well-being and our staff from health promotion. So there's a lot happening, and it's about absolutely making every contact count.
And sorry, Mark, just very briefly, just add to Tony and Breda, Tony makes a great point about the opportunity we now have. People have much more consciousness now about public health and what that means, and particularly their capacity to make a difference. So I think that's something we can build on. And finally, just to say again, in our corporate plan, there's 3 kind of areas identified with our board that we identified Ireland are outliers on. And they are, firstly, in terms of children and prevention, early interventions with children to make it count. Secondly, in terms of obesity, we are an outlier in Ireland, particularly across Europe, in terms of obesity. And thirdly, around alcohol and how we relate to alcohol and some of the challenges we have as a nation around alcohol. So I think those 3 have been identified as kind of health prevention priorities for us as well.
Okay. Someone here saying, my concern as a director of nursing is we have a very tired workforce. They've been extremely flexible for the greater good. We're really dependent on staff working hours of overtime. Staff have been redeployed to support mass vaccination centres. Many have had annual leave cancelled, and the current plan for rolling out the vaccine to the over 70s is complex. A lot of IT challenges, many layers of work involved in identifying first doses and second doses, etc. It's not getting easier. So I think all this reflects what a lot of people might be feeling in different parts of the country. What can we say to staff? Really, we're trying to return to normal service, and still the exhausted staff are facing huge pressures.
I'll come in here, Mark. Certainly, I understand that, and I see it myself. Our staff are absolutely magnificent. They have done tremendous work, and they are tired. And, you know, we've come through it. It's been like a year like no other. It's been a tough 12 months. Now, what we've done is we've invested in psychosocial supports. So there's a lot of supports there for people, you know, in relation to small daily steps, you know, various programs that we have rolled out, and they're available on our website, on social media and so forth. And I think even though staff are tired, you know, they want to do the best. And I suppose what we have to do is to ensure that they get their rest days as well, because we need to make sure that they're available and that they, you know, look after their own mental health, look after their own work-life balance. And I suppose when we've rolled out the remote working, and that certainly has helped that. You know, staff, okay, frontline staff, it has been tough. It was scary because people, you know, were scared. We had to learn how to don and doff PPE. We had to learn, as that lady has said, in relation to a lot of, you know, different ways of working. But they have taken to it. And, you know, when you look at Attend Anywhere, when you look at, you know, the e-health, e-psychiatry, you know, people have taken to it and they are using it. And actually what we're finding is that our service users enjoy it, in particular the younger people, but older people have taken to it as well. And when you look at the nursing homes, you know, iPads, you know, people, Zoom calls, all of that kept people going. So, you know, it is absolutely, we need to look after each other, and we need to mind our staff for sure.
Okay, Tony?
Yeah, just look, I'd be very conscious of the fact that as managers, we have a huge responsibility to staff. You know, at the end of the day, this is a service that's provided to human beings by human beings, and so we have to be conscious of that. I think in my head, the way that I'm looking at it, and I suppose to some extent, I think we're all crossing our fingers, you know, that things continue in the path that they are. But the way I'm looking at it is that there's a huge responsibility on people like me to make sure that we do the very best that we can in terms of the vaccination program, get it rolled out as quickly as we can, and get the benefit of the vaccination program in place as much as we can. And we then need to incorporate into our planning, how do we give staff the break that they need while also then trying to get services back up and running. We can't ignore staff in making those plans. We have to include staff and the needs of staff in making those plans. So for the moment, I guess in my head, the priority is vaccination program, get it done as quickly and as efficiently as possible, and then try to see what we can do after that.
Mark, just a couple of quick comments if I can. I think many of the public, you know, are tired and angry and frustrated, and we all understand that. And sometimes we receive, you know, we receive the experience of people being tired and angry and frustrated, but, you know, our own staff are equally very tired and frustrated as well, because I think back, many of the public think a date they will always remember, whether it's the first day of the lockdown or the first case in Ireland or sadly, the first death in Ireland. But the first date I always remember is the 26th of January of last year. And that was when the first cases arrived in Europe. And I always remember I was down in the West, and I got a phone call to say, you know, 2 identified cases in Paris and 1 in Bordeaux. And I knew then, this is it, you know, and since that date, our teams have been working on this. So while people talk about February and March and April, this goes back to January, where our staff have been working relentlessly on preparing for this, preparing for ICU capacity, preparing for stepping up beds and teams. So it's been a long 15 months for everybody. And with Tony, I think what we all need to give ourselves, first of all, watch out for each other. Watch out for each other is not easy, but it's something we need to work hard at. But I will say, I think we can go into this with greater hope. Hopefully all of you who've been vaccinated, you know, see the benefits of it, experience the benefit of it, and look at the great joy as we are vaccinating people, and many of you have been in those centres and are vaccinating people. It's a great joy and privilege to see what's happening. And over a very short period of time, in the next 8 to 10 weeks, we will be reached out well into the community, and I think we will see the nation's mood lifting, and it might help us to, you know, get that second wind again.
Okay, thank you. Question from Michael. There's been substantial additional funding for the health service in 2021. Will there be a particular capital fund to improve infrastructure in the West, and are there plans in that regard? Maybe Tony?
There are certainly plans. I suppose all of our hospital sites, we have developed specific plans and many of them were developed before COVID to address things, for example, like bed capacity, aging infrastructure, healthcare infection resilience, and so on. And all of those plans have had to be revisited in the context of what we've learned through COVID-19. In Galway, for example, we have very significant deficits, but also we have very significant plans. We need to replace the emergency department urgently. I think it's at least 5 years since the then Taoiseach declared it as unfit for purpose. We have a requirement for additional bed capacity in GUH, the largest Model 4 hospital in the West, that's currently creaking at the seams on a daily basis. In Portjunkle, we've actually started some of that work, and that will continue over the next while. We have a plan to develop a 50-bed ward block there, which is progressing well, and will add very significantly to the infrastructure, which has a lot of problems currently, but those 50 beds will help a lot. And there are other plans for Portjunkle as well. And in Mayo, believe it or not, in the window between the first wave and the second wave of COVID, we got into two of the large wards in Mayo University Hospital and did some refurbishment work around patient facilities, particularly, I suppose, where we noticed difficulties around shared toilets and showering facilities, but other elements of the infrastructure as well. And so we used a 12-week period, or at least our estates teams and contractors moved in, and in a very tight window, they took over and refurbished two of our main wards in a hospital that serves 140,000 people at a critical time, and did some really good work. All of our other hospitals have significant plans as well, and we're all the time looking a little bit further down the track and hoping that the money will be there to meet our ambitions.
I might come in here, Mark, as well, just to say in older person services, the capital plan is there, the replacement of the CNU in Merlin Park, Sacred Heart Hospital, Roscommon, the design of that, Clifton CNU, the replacement of it, and the district hospital there. Disability services, the congregation program of Mayo Community Living Services. We're rolling that out really fast, and beautiful homes for people, quite rightly, that they can live in. And in mental health and disabilities, then we're looking at day hospital and co-location of services. Also the primary care centres, they're also rolling out. So there's a lot of investment. There'll never be enough money, but certainly there are prioritised projects, and also the minor capital in relation to maintenance and urgent issues. And if you look at the money that was put into getting back to businesses as usual, putting in additional screens, putting in new entrances and all of that. So there's been a lot of work, and we work very closely with our colleagues in estates. And the whole investment now in integrated programs for older people and enhanced community care facilities. We are looking at premises so that people can be located and provide really good services. So, there's a lot of investment there.
Okay, thank you very much. I'm conscious we have around 10 minutes left, and there's a big issue. There's a number of questions about in relation to the Beacon Hospital for some reason. People asking how, Paul, maybe you'd like to address like the kind of sense of undermining of the vaccination program that's taking place, arising from news about what happened at Beacon Hospital and other stories about people supposedly getting vaccines out of sequence and so on. Would you like to maybe address that? Because I know we're hearing an awful lot of concern among staff that this is just undermining an otherwise really good program.
Yeah, thanks, Mark. And look, geez, I'm actually glad to have the opportunity to talk about this one overall. Firstly, and we stand back from it all, first of all, thanks for everybody, what you're doing on the vaccination program. Everything we're getting is being vaccinated within the same week. 95% of anything we get in 1 week is administered in the same week. We've one of the highest efficiency vaccination levels in Europe. We wish we had more. We are getting more. This month really scales up, about 1 million a month from now on. So just first of all, thanks to all of you for what you're doing. Second, to say the vast majority of the 860,000 vaccines that we have administered have gone to the right people. 99.odd% have gone to the right people. And that's the second thing to say to everybody. Thirdly, the reason I can say that is because look at the benefits of what we're seeing, what I just summarised earlier on. Thirdly, where something like the Beacon happens, it completely does undermine. It's like a body blow. It's reprehensible, what happened. I've been very publicly on the record about that. It's you know, so it's you know, and we're formally launching an investigation very shortly. I'm just closing it out at the minute, and that will happen. And separately, they are launching their own investigation. So won't speak too much about it, other than it's a severe blow when something like that happens. What I would also say is it's also important for us to make sure we're going into a press conference now after this at 2:00. We do it every Thursday for 2 hours. We're going into press conference with all the journalists. And as you can see, they're picking up a lot of those exceptional cases that happen where someone has skipped the queue in their description of it, and someone has got through and hasn't been validated at the vaccination centre. So all of them add up to a lot of noise, explosive kind of noise around it. And, you know, it hurts because every one of those examples are not reflective of the vast majority of how well managed this whole vaccination program has been. So I'd use the opportunity just to urge everybody involved in the vaccination process. We're writing out again to people in the vaccination centres. Make sure we're validating as people coming in, checking who's who getting the vaccination, because that's increasingly one that's being reported of people coming through not having been validated getting the vaccine. But specifically back to the Beacon, it stinks of a privately funded organisation abusing its privilege of public funds to support another private organisation with those public funds and those public assets, and that goes against the core of everything that we all value in the public service and the public health system. So I hope I can't be any clearer on it, but I think we should equally use it as an opportunity to strengthen any weaknesses we may have ourselves, because, you know, that will emerge too. Thank you.
Mark, I don't have any commentary to make in relation to the Beacon. Certainly not to add to what Paul has said, all of which I agree with fully. But one of the things that we've noticed in the rollout of the vaccination program is that, you know, there have been lots of different setbacks along the way. You know, problems that we've come up against and that we've needed to change direction or adapt to. And it's one of the things, I suppose, that over the last month in particular, remember in the middle of March around the AstraZeneca vaccine and how we had to pause that for a period of time. And, you know, it was at a time we were just building up real momentum around the vaccination centres, you know. So I guess one of the things, conscious of the fact that that this is a staff, there's largely staff that are in the audience here, one of the things that we have to keep doing is we have to keep adapting. There will be lots of hurdles along the way. There will be lots of problems along the way, and we have to keep adapting and at all times trying to keep the momentum going as we change direction. So it's a lot easier said than done, but it's an incredible tribute to the staff that have been involved in this, that they have done that over and over and over again. And just when things you think we're on the right path now, it's straightforward from here on, it changes, and staff have adapted to that. They've been absolutely superb.
And could I also echo that? Certainly, you know, staff have really taken this on board. They have rolled it out. You know, as I said, within our long-term care facilities, we've almost 19,000 vaccines given. We've worked very closely with Tony. Indeed, we have a meeting every Monday to go through all of the vaccination program. You know, and when I look at it, you know, I've already talked about, you know, when I went over to Unit 5 and 6 here in Merlin Park, to see the joy, the sense of celebration, and, you know, social media. And again, I'm glad, Paul, that you mentioned communications, because certainly we are getting the message out there. And, you know, we've had examples where the Jerus Lima Dance Challenge, Plunkett Nursing Unit in Boyle, the Sacred Heart Hospital in Roscommon, Oris Ronan on Inishmore, and even this morning, and it was really quite an emotional piece in relation to the vaccine, Frank Connaty and his son Matthew, who received the vaccine, you know, in disabilities. And my God, it is just so powerful. So fantastic work and great hope for the future.
Okay, thank you very much. I'm conscious we have 4 minutes left, so in a minute I'm going to ask each of you maybe if you could give us 30 seconds of what message would you like people to take away from this into the future and so on. And while you're completing your thoughts, I just thank everyone for being here. The recording of this will be available on the staff website. People have asked questions we haven't had time to answer, but we'll get back to each person individually. Maybe if somebody's on mute, they might do it. I might be you, Paul. Yeah, great. Yeah, questions we haven't got to answer, we will get back to you all individually with those answers. And hopefully we will do this again soon. But thank you all very much for being here. And it goes without saying, thank you for everything that you're doing. So maybe I'll ask Breda, you might tell us briefly, what would you like staff to take away into the next quarter?
I think staff are our greatest asset, and there was a line in Shaping a Healthier Future a number of years ago that services will stand or fall on the contribution of staff. So that's really important. The second thing is huge investment in relation to, we're getting an additional 33.8 million full year costs, an additional 200 staff. We're rolling out Sláintecare on speed, really. The investment in relation to, we had no infection control, staff. We now have an assistant director of nursing. We now have clinical nurse managers. People know how to use infection prevention and control. And this is the future, because we're going to be living with COVID for quite a while. But I think that, we have the assistance, we have the facilities, we have the investment. So I really am quite hopeful for the future. And, again, our staff have been absolutely magnificent. And at the end of the day, it's about our core values, trust, compassion, learning, and so forth, and about being accountable and being proud. And I honestly am proud to be a member and an employee of the HSE. That's what I'd like to add.
Sorry, Tony, if you had to add there.
Yeah, just a very, very simple message, and it's to say thank you. Thank you to every single member of staff for everything that you have done over the last 12 months and everything that you're probably going to do over the coming 12 months. I know that none of you comes to work to get a thank you from Tony Canavan, and that you come to work and you do what you do for lots of other good reasons. But nonetheless, that's my simple message. Thank you.
Thanks very much, Tony and Paul.
Yeah, just three quick things to wrap up. First of all, everything that everybody has done who's worked in the HSE over the last year has strengthened the public's trust and confidence in the health service. And I think that's no mean achievement. And we can track it and we know it and it's there. Second thing to say is, not just have you strengthened the trust and confidence of the public, you've strengthened the trust and confidence of government. We didn't get an extra €4 billion this year just because government had it, because they didn't have it. We got it because what was being demonstrated, the change, the innovation, the pace, the services, the protections that's been put in over the past year made the business case better than anybody could. So you've made that case. We've got an extra €4 billion from government. And the third one, which both Reid and Tony have said, I would say as well, do look forward to this year. We'll do look forward to the next 3 to 5 years with greater levels of confidence about the health service, with greater levels of confidence about what we're going to achieve, greater levels of confidence about how we continue to build on what we've done, but particularly with a vaccination programme that gives us at least a short-term lens to look forward with that confidence. So again, thanks to all of you, and it's a great privilege to talk to you again today.
Okay, thanks very much, Paul. And a final point, there's research done from time to time in relation to advertising campaigns we run, and we ask people what they think of the health service and so on. Over the past year, those ratings have been higher than they've ever been, and that's all thanks to the work everybody here and everyone else is doing. So as a communications person, I look at the front pages of newspapers every day and groan, but I think you should always know that the public view of what the health service is doing and whatever it is doing isn't necessarily reflected in what you see in the media. So thank you very much, and hopefully we'll do this again soon.
Thank you.
Thanks, Mike.